Over 70 beware. These 5 health checkups that could do more damage than good. If you're over 70, you've probably been told countless times how important it is to stay on top of your health and get regular checkups. And there's truth to that. But what if I told you that some health checkups, even ones that sound smart and responsible, could actually do you more harm than good? This might sound shocking, because we've all been raised to believe that early detection saves lives, and in many cases it does. But there's another side to the story that few people talk about. Hi, I'm Dr. Anthony. For over 15 years, I've been working with seniors, helping them protect their health without falling into the trap of unnecessary testing. One of the biggest shifts in medicine over the past decade has been realizing that more tests do not always mean better care. In fact, certain routine checkups can cause unnecessary stress, expose you to risks, and even lead to treatments for problems that would never have caused you harm in the first place. This is called overdiagnosis, and it's something we see far too often in people over 70. Let's start with one health checkup that's often overused in seniors' routine: yearly EKGs for people without heart symptoms. Many seniors believe that getting an electrocardiogram every year is a good way to catch silent heart problems early. But here's the truth: if you're over 70 and you're not having chest pain, shortness of breath, palpitations, or other heart symptoms, a routine EKG is unlikely to find anything meaningful. What it can do, however, is pick up harmless variations in your heart rhythm that become more common as you age. Once those variations are found, doctors might feel obligated to order more tests like stress tests, echocardiograms, or even invasive procedures like cardiac catheterization. I had a patient named Jim who was 72 and feeling perfectly fine. He went for his annual checkup, and his doctor included a routine EKG. The test showed a slight irregularity, which led to a treadmill stress test, then a nuclear scan, and finally, a heart catheterization. After all those tests, the doctors found nothing dangerous. But Jim went through weeks of anxiety-invasive tests and significant medical bills, all from one routine EKG that wasn't necessary in the first place. He told me, "Dr. Anthony, I wish I'd never started down that road." It's not that EKGs are bad. They're essential if you have symptoms or a history of heart disease. But doing them routinely in healthy seniors without symptoms often leads to a cascade of further testing that might not be needed. Another checkup that's often unnecessary for people over 70 is routine chest X-rays in people who don't have symptoms, like a cough, shortness of breath, or unexplained weight loss. Many seniors get an annual chest X-ray, thinking it's a smart way to screen for lung cancer or other problems. But routine chest X-rays in healthy people rarely find anything useful. What they do often find, however, are tiny spots or scars in the lungs that are harmless but look suspicious. Once those spots are found, they usually lead to further CT scans, biopsies, and even surgeries that carry their own risks. One of my patients, Linda, was 74 and in excellent health. She went for an annual physical, and her doctor ordered a chest X-ray just because she was a former smoker decades earlier. The X-ray showed a small shadow on her lung. Linda became terrified, imagining the worst. She went through 3 more CT scans over the next year and even had a needle biopsy. In the end, the spot was nothing more than an old scar from a childhood infection. But Linda went through months of worry, radiation exposure, and a painful biopsy that wasn't necessary. Routine chest X-rays might sound harmless, but they often lead to a domino effect of further testing. That's why many medical societies no longer recommend routine chest X-rays in people without symptoms or high-risk factors. A third checkup that might cause more harm than good in seniors over 70 is routine thyroid testing if you have no symptoms. Thyroid function can fluctuate naturally as we age, and many older adults develop mild changes in thyroid hormone levels that don't actually cause any health problems. But once a thyroid blood test comes back slightly abnormal, it often leads to more blood tests, ultrasounds, and sometimes even biopsies or unnecessary treatments. I had a patient named Carol, who was 71. She felt perfectly well, but had a routine checkup where her doctor ordered thyroid blood tests. The results showed her thyroid hormone was a little low, but she didn't have any symptoms like fatigue, weight gain, or feeling cold. Despite this, she was referred to an endocrinologist and started on thyroid medication. Over the next year, she felt jittery and lost weight because the medication pushed her thyroid levels too high. We eventually stopped the medication, and her symptoms disappeared. Carol told me, "Dr. Anthony, I wish they'd never tested my thyroid. I felt fine until they started treating me. Routine thyroid tests should not be done unless you have symptoms suggesting a problem. Mild abnormalities in thyroid hormones are common in older adults and often don't need treatment." Another health checkup that many seniors over 70 often go through without really needing it is routine vitamin D testing in people without risk factors or symptoms. Vitamin D has become very popular in recent years. Many people believe that low vitamin D is the cause of fatigue, bone pain, or even depression. But here's the reality. Mild variations in vitamin D levels are common, especially in older adults, and don't always mean there's a problem. I had a patient named Martha, who was 70 and in good health. She went for a wellness check, and her doctor ordered a vitamin D test. Her level came back a bit low. Immediately, she was prescribed high-dose vitamin D supplements. Within a few months, Martha began experiencing nausea, loss of appetite, and frequent urination. Blood tests revealed that her calcium levels were too high, which can be dangerous, especially in older adults, because it can damage the kidneys and cause confusion or heart rhythm problems. We stopped her supplements, and her symptoms slowly resolved. The truth is that for many healthy seniors who get some sunlight and eat a balanced diet, routine vitamin D testing isn't necessary. Testing should usually be reserved for people with specific risk factors like osteoporosis, certain gastrointestinal diseases that prevent absorption, or chronic kidney disease. For everyone else, moderate sun exposure and a balanced diet often provide enough vitamin D without needing constant monitoring or high-dose supplements. Another test that's frequently overused is routine imaging for back pain in seniors. Back pain is incredibly common as we get older. Disc degeneration, arthritis, and muscle strains are a normal part of aging. But many seniors think that if their back hurts, they immediately need an X-ray or MRI. The problem is that imaging the spine often shows many abnormalities, like bulging discs, mild arthritis, or degenerative changes that sound scary on a report, but might not be causing the pain at all. I had a patient named Robert, who was 75. He developed lower back pain after gardening one weekend. His doctor ordered an MRI right away, which showed several bulging discs and mild spinal stenosis. Robert became terrified and thought he needed surgery. But after we talked, I explained that most people his age would have those same findings, even without pain. We decided to treat his symptoms with gentle physical therapy, heat and activity modification. Within a few weeks, his pain was completely gone, and he avoided unnecessary surgery. Robert told me, "Dr. Anthony, I'm so glad I didn't rush into surgery just because of that MRI. Routine imaging for back pain without serious symptoms, like leg weakness, loss of bladder control, or significant weight loss, often leads to more interventions that may not be needed. Sometimes knowing less is better because it keeps us from treating harmless age-related changes as serious disease." One more patient, Helen, who was 72, developed mild back pain after moving some boxes. Her doctor ordered an MRI, which found a small benign cyst in her spine. That led to months of worry, several neurosurgery consults, and discussions about surgery for a cyst that was not causing any symptoms. Eventually, she realized she felt fine and decided not to pursue surgery. She told me later, Dr. Anthony, "I wasted months worrying about something that wasn't even a problem. Over-testing can lead to a cycle of worry and interventions that don't actually improve health outcomes. That's why guidelines recommend conservative treatment first for most types of back pain, unless there are red flag symptoms that suggest something more serious. I want people over 70 to know that while medical technology is amazing and can save lives, it also has a downside when used too freely. Many tests seem harmless, but carry hidden risks. Exposure to radiation anxiety from uncertain results. Invasive procedures that carry complications and unnecessary treatments that may lower your quality of life instead of helping it. I always encourage my patients to ask questions before agreeing to a test. Why is this test being ordered? What will we do differently based on the result? Are there safer alternatives, or can we simply monitor things for now? Good doctors welcome these questions because they help ensure that testing is truly in your best interest. In the next part, I'll share practical tips for how to talk to your doctor about whether you really need certain checkups, and one last patient story that shows how avoiding unnecessary testing can help you stay healthier and happier. Let me share one more story that perfectly shows how avoiding unnecessary checkups can sometimes protect your health rather than harm it. I had a patient named Edward who was 74 years old. Edward was an active man who loved fishing and spending time with his grandchildren. He felt perfectly healthy, but decided to sign up for a free health screening event at his local community center. At the event, they offered several tests, including a carotid artery ultrasound, even though Edward had never had any symptoms like weakness, dizziness, or vision problems. The ultrasound found a small plaque in one of Edward's carotid arteries. Even though it wasn't blocking much blood flow, the doctors recommended further testing. Edward ended up having multiple CT scans and consultations with a vascular surgeon. He became anxious, had trouble sleeping, and started worrying that he might have a stroke at any moment. Eventually, he was scheduled for a surgical procedure to remove the plaque, but during surgery, there was a complication that caused temporary weakness on one side of his body. After months of rehabilitation, Edward finally recovered. But he told me, Dr. Anthony, "I wish I'd never had that first test. I felt fine before all of this started. Now I realize that not every test is necessary, especially when you have no symptoms." Edward's story is a powerful reminder that sometimes the cascade of follow-up tests and treatments triggered by a single screening test can do more harm than good. One of the most important things I tell my patients over 70 is that your healthcare should be tailored to you as an individual. Medicine is not one size fits all. The tests and checkups that might be helpful for a 50-year-old may not be necessary or even safe for someone in their 70s or 80s. The reason is simple. As we age, the risks from testing and treatments increase, while the potential benefits sometimes decrease. Another key concept to understand is overdiagnosis. This happens when doctors find conditions that look abnormal on tests, but would never have caused you any harm during your lifetime. Once we discover these small issues, it's hard for both doctors and patients to leave them alone, even if they're harmless. This leads to more tests, procedures, and anxiety. The end result is that people sometimes go through surgeries, biopsies, and treatments for things that never would have made them sick. That's why I always encourage my patients to ask some important questions before agreeing to answer to any medical test. Why is this test being done? Will the results change how we treat my condition? What risks does the test have? Is there another way to monitor the situation instead of jumping into testing? Good doctors are always willing to have this conversation. We want you to be informed and comfortable with the decisions you make about your health. One patient, Nancy, who was 71, had a routine thyroid ultrasound that found a tiny thyroid nodule. She felt completely healthy and had no symptoms. The finding led to multiple follow-up tests, including needle biopsies and several endocrinology appointments. She became anxious and feared she might have thyroid cancer. In the end, the nodule was completely benign and harmless. Nancy told me, Dr. Anthony, "I wish I'd never known about it. I spent a year worrying for nothing." Her story shows that sometimes knowledge isn't power, it's a source of stress when the information doesn't change how we live or how we feel. The truth is that good health care for people over 70 is not about doing every possible test. It's about choosing the right tests that truly improve your health, avoid harm, and preserve your quality of life. That means saying no to some checkups if there's no clear benefit. It's about balance and making decisions that are right for you. Let's quickly review the 5 health checkups we talked about today that people over 70 should think carefully about before agreeing to. First, routine yearly EKGs in people without heart symptoms. Second, routine chest X-rays in people without symptoms. Third, routine thyroid testing in people without symptoms. Fourth, routine vitamin D testing without specific risk factors. And fifth, routine imaging for back pain without red flag symptoms. These tests are not evil, and they're definitely life-saving when truly needed. But in many cases for people over 70, they create more problems than they solve, leading to unnecessary stress procedures and costs. Your health deserves thoughtful care that fits your unique situation. If you're over 70, remember that you have every right to ask questions and to be part of every decision about your care. You deserve to know both the benefits and the risks before agreeing to any test. If you found this video helpful, please subscribe to this channel for weekly doctor-approved health tips designed especially for people over 60 and 70. Give this video a like so that more people can discover these important insights and avoid unnecessary risks. And leave me a comment below. Have you ever had a test that led to more problems than it solved? Or is there another health topic you'd like me to cover in a future video? I read every comment, and your stories help me create videos that truly help people. Thank you so much for spending your time with me today. Take care of your health and take care of yourself. I'm Dr. Anthony, and I'll see you in the next video.